Hi all, today we are going to see about schizophrenia. What is schizophrenia? Of all the psychotic disorders, schizophrenia has more severe impact on people's lives and on healthcare system. In United States, there are more than 2 million people uh, or more than 1%. In 2 million people, there are nearly 1% of the people who's affected by schizophrenia, like the chronic or disabling diseases in any given year. Okay, as this is said by Springle in 1999. Yes, despite the relatively small percentage of total US population affected, the seriousness and the incapacitating consequences of schizophrenia mean that about 50% of those affected will become, yes, the person who got affected will be affected severely. Okay, their symptoms will be very severe. Individuals diagnosed with schizophrenia make up 10 percentage of the permanently and totally disabled populations and constitute a significant percentage of homeless populations. Okay, they will be 10 percentage or permanently affected by schizophrenia. Okay, yes. The next is in about one in every four patients with schizophrenia they will harm themselves because of the severity of the symptoms. Okay, and in one in every 10 who will try will succeed. Okay, some will kill them because of the severity of the symptoms. Those patients will choose suicide or in some ways to those in general population. Why this is because of the feeling of hopelessness. Okay, like they will be feel alone, they won't mingle with anyone, they will be easily isolated. Okay, yes. Schizophrenia, as defined in DSM-5 probably includes several disorders. There are several disorders associated with the schizophrenia with different causes that are currently lumped together because there is not enough knowledge of the critical factors that differentiate them. Okay, so all these were combined as one. The traditional way of categorizing schizophrenia is divided into subtypes. They were derived into subtypes, and we view as a disorder. Okay, regardless of how they splitted the symptoms into two things. That is, they are called positive schizophrenia and negative symptoms. Sorry, positive symptoms and negative symptoms. Yes, the symptoms. Schizophrenia symptoms are divided as two as follows: positive symptoms and negative symptoms. What are the positive symptoms? That are distortion or excesses of normal function. Okay, they won't be able to properly function in their. They won't be do their daily routine. Okay, a person may hear things. Okay, that is the false belief will be there. Hear things that do not exist, believes false ideas, behave strangely, speaking in confusing ways. Okay, the most important positives are delusionation and hallucination. Hallucination is nothing but uh, they will see something which won't be there, that is similar to illusion. Okay, delusion is the false firm belief. Okay, yes. Delusion is a false fixed belief that continues even when evidence proves it's wrong. Yes, the patient with schizophrenia will be having the false belief. Okay, that will be very strong. Okay, there are some types of delusion. First is the bizarre. Bizarre is the impossible. Like people can hear my thoughts. Okay, that won't be possible. But the patients with schizophrenia will be having these issues. Okay. Yes. The next is referential delusion, like the person. If a person is standing the person near the schizophrenic symptom person, that schizophrenic symptom patient will think that he or she is talking about me. They are trying to murder me. All these thought will be come to these patients. Okay. Next is persecutory delusion. Persecutory delusion is nothing but the person believes that they are trying to spying on them, or the individual is trying to harm them. Okay, yes. Next is grandiose delusion. Grandiose delusion that the person believes that they are extremely important, powerful, or divine. They will be like, I am the God, I know everything. So their thing will be like that. I mean, their thoughts will be like that. Okay. Religious delusion. The person believes they have a special religious identity or mission. Example: someone believing they are Jesus Christ or a prophet is. This is the religious delusion. Okay, how it affects the individual. Delusions can lead to dangerous action because the person behaves according to their false beliefs. They will be started behaving very abnormally because of their false belief. Okay, so William Tagger, who believed television networks were attacking him with rays through his TV sets because of delusion, he was affected. It affected his behavior. Okay, delusions. The delusions will be fail real to the person who is having schizophrenia. Okay, patients may act logically according to the false belief. Okay, yes. Next is hallucination. Hallucination is nothing but or false sensory experiences occurring without an external stimuli. Okay, the person experiences sensation that others cannot perceive. Okay. Yes, the types of illusions are auditory illusion. They will be hearing some voices or sounds that which won't be there. Okay. Next is the gustatory hallucination. That is like experience taste without. They will be experiencing the taste without eating or drinking something. Okay. The next is visual hallucinations, seeing things that won't be real. There won't be anything, but they will be telling that someone is standing, someone is watching. All these will be experienced by these person. Next is the tactile hallucination, that is the feeling sensations on the body. They will feel like feeling insects crawling under the skin. Olfactory is smelling orders that does not exist. They will be able to sense the taste which won't be there. Okay, like smelling poison or smoke constantly. Okay, yes. Thank you.